So, Delphine and David, thank you for coming here. First of all, the title of this session is Museums as Medicine. That is, of course, inspired by your project. Could you quickly summarize what the project is about?
So it's great. Thank you. So it's very simple. It's the museum on prescription. It means that doctors, but not only, can prescribe free visits to the museum to their patients because it has been shown that it's good for our health.
Yes, and you were, if I'm not mistaken, Delphine, one of the driving forces behind this project in Brussels?
Yeah, exactly. The first driving force, because I've heard about that project. It's inspired by what has been done in Montreal, Quebec. And so I read it in the newspaper and I thought it was a nice idea. Then I went there to meet the people who put it with the Fine Arts Museum and the Association of French-speaking Doctors of Quebec. And coming back here, I thought it was a very, very good idea. So we launched it in a kind of pilot project in 2022 with the 5 museums of the city of Brussels and the Brugmann hospital, which is the biggest public hospital in the whole region.
Yeah. And David, if I may turn to you, what is exactly your role in the project?
Well, I work for the Department of Culture of the city of Brussels, and I've been following up this project more on a practical basis for the last 8 months, I think. And we're preparing now the next phase, because after the pilot phase, there was already a first phase, and now we're entering in June, July, the second phase of the project.
Yeah. We're going to dive a bit deeper in exactly what you've already done and where you're going to with the project. But first, you mentioned Canada, Montreal, it's quite an innovative museum there. They do a lot of forward-thinking things. So look up the Museum of Fine Arts in Quebec or Montreal. It's the same. Yeah, Montreal. The same place, actually. Little instinker. So you traveled to Montreal actually in 2019. What did you learn there?
So I learned how it works. So it's very simple to understand. So they launched the project in 2018. So at the end of that year, so it was just the beginning of the project when I went there. And I met Nathalie Bondil. She's now working in Paris. But so she launched the project. It was very simple, as I said. And so they worked with the Fine Arts Museum. So there was one cultural institution, partner of the project, and the Association of the Doctors, so French-speaking doctors. So the aim is really, really simple. It's just to give doctors new tools, because we know that the doctors prescribe medicine, drugs, and of course it's part of their job. But as it has been proven, culture is really part of the answer, because when you go to a concert, when you go to a museum, when you have that kind of experience, and we all know that, when you're just taken by what you are looking at, what you are listening to, it makes you feel better. You forget about your problems, or you are there with a friend and you can talk. And, it just reminds us that we are human and that we need culture. And yes, of course, I've been there in 2019. So coming back to Brussels, I was like, we have to do it. So we launched it with Brugmann and our 5 museums. But 2020, you know what happened? COVID. So it was a very terrible time for hospitals, terrible time for culture, because most of our cultural institutions were just closed. And we saw how much we need culture. Culture is essential, and I think we will all agree on that here. But that was not the main message at that time. So it was not the right moment to launch it. So that's why we waited 2022 to have the pilot project. And we took the time to go deeper into details, but it's really important, because we didn't want the people to be stigmatized, because we were working with the psychiatry department of Brugmann, so working with people suffering from stress, depression, that kind of mental disease. And we wanted to be sure that these people, when they go to the museum, that they don't feel stigmatized, that it's not like they don't have a label on the face saying, I'm sick, I'm not feeling well. And at the same time, so it gives new tool to the doctors, because culture helps the people to feel better and to be cured. So really it has been shown, and it's also a way for the museum to get new audience, new public. And we know that, you know, we have teams like really striving to get new people into the museum, because we know there's a kind of elite, people who go to the museum because they know they can, but there are so many people in our society who don't dare to enter a museum. And I'm not even talking about the price to enter it, because, you know, every Sunday, every month, it's for free. But most of the people don't know it, don't dare to do it. And it was really a way to give new tools to the doctors, and also to attract new people to the museum, because when you're sick and you go to the hospital, but well, you know, we take care of everybody in our public museum, so we knew that it was a way to touch people that the museum maybe cannot touch.
Yeah. So, indeed, somebody want to applaud. Don't hold back. We're discussing nice stuff here. So, in a way, you're not only helping the people with their health, whatever that may be, you're also helping to get museums, get new people through the door. Yeah. Health-wise, you mentioned mental health, you mentioned stress, but could you quickly run us down which types of afflictions or health problems people can get a museum prescribed for?
Actually, it's for everybody. We started with mental health issues because it was the way we thought was the easier. And so the pilot project was only focused on mental health issues, so working with the psychiatry department of Brugmann. But in 2019, the World Health Organization published a huge report based on more than 900 scientific studies showing how art and culture can be beneficial for our mental and physical health. So based on that, it's proven. So we know it's for everybody. So that's why I wanted to start with a small group, because when you work with that kind of people, you want to support them, and you want to protect them, and that everything is doing well for them. So that's why I wanted to have a small start, because there are also issues like medical secrecy and that kind of questions. So after 6 months, everybody was so enthusiastic about that project, because I was always having like phone calls from other museums, like, why am I not part of that project? I really want to be part. And like, I'm a doctor working in this neighborhood, and we have psychologists in our team, so why couldn't we do that? And so everybody was so enthusiastic, so we took the time to assess the project, and everybody was very positive, but we improved it somehow. Regarding mediation, we also opened it to group visits, and now it's open to, so we started with one hospital and 5 museums, and we are now with 18 health partners and 14 cultural institutions, federal, regional, public, private, you know, the whole Belgium lasagna, but they are all based on the territory of the city of Brussels, but good news, there's a lot. So, we are now, so it was in 2024 that we decided to enlarge the project. We have a lot of partners, like for the health sector part, we have more than 160 people prescribing that kind of visits. Of course, we have psychiatrists, but we also have psychologists, social workers, midwives. We also have, as a partner, the Alzheimer.
Physiotherapists, we have Alzheimer Belgium, we have several kankerpatiëntenorganisaties, cancer patient organizations.
Yeah, so a lot of different profiles. So it's for everybody. It's for everybody. And I think what is also very important with that kind of project is that you remember the people that they are a citizen. And this is really the role. It's a key role for a museum, because it reminds the people that you're not only sick. You know, when you go to your doctor and you're suffering from stress, depression, or anything else, you just feel like you're apart from the society. And when your doctor prescribes you some drugs, well, there's no discussion to have. You have to take it, and that's it. And here, it's a whole different way of taking care of the people, because this is part of the healing process. Doctors have the opportunity to visit the museum, so they know what they can recommend to their patient, and they talk about it. So on the prescription, they choose together the museum. We have here a beautiful example of the prescription.
Oh, wow.
Here. So yes, it's a way of talking about it, and for the doctors, it's really interesting because they can talk with the patients in another way, and know their patient, in another way, and so. Yeah, it's very important to show that these people can be actors because they can be accompanied. So we can see here the first question is like, can you be with someone else? So it's for free for the two people. And so it was really core for us to show that culture is also a way of making society together. And it was after COVID, so everybody had to stay alone, and we really wanted to show that culture is part of the answer for mental health, but not only. And these two sectors suffered so much in that period, and mental health is still a taboo in our society. You can say that you broke your leg, but just say you're in burnout. Not that easy. And here you can be an actor of your healing process, and museum can be part of that. And this, I like it so much.
I can see you like it, and I think we all like it too. Before I dive into like the reactions of museums and the people and the medical institutions, you mentioned a lot of stakeholders, different institutions, different types of people. We're also in the Belgian lasagna. David, is this not quite complex to manage with all of these different parties?
Well, it's not so much complex, it's really time intensive. But I come from mediation, publiekswerking. I don't know how you call it in English.
I have no idea.
So I'm used to that it takes a lot of time for what you could say is quantitative small results, but that's not what it's about. It's about giving opportunity, even if it's only to one person or one group of people. So, yeah, we've been doing a survey with all the medical partners and all the museums. And of course, I come from a very cultural background, so it was a real eye-opener to meet all these medical structures. And yeah, I think we're quite ready to prepare for the next phase. We will have some new museums entering, also some new medical structures. But our ultimate dream, of course, would be that it would be on the level of the federal level in Belgium, or even better on the European level.
We can only dream, and hopefully that dream comes to fruition. You mentioned the survey. What were the results of that survey?
Well, we got to know a little bit better all the different stakeholders we're working with, and we could also, of course, we never are in contact directly with the people who go to the museum. That's very important to understand it in construction, because there's the medical secrecy, and also we don't want to stigmatize people. So we will never be directly in contact with them. So all the feedback we have is through the health organizations we work with. But they were almost overall positive. And the last question in the survey was, would you continue within the project? And everybody will continue. So that's quite good news.
That's nice to hear indeed. Delphine, you've been with the project from day one, or day zero perhaps even. Have you gotten any perhaps anonymized feedback from like patients that you can share?
Yeah, of course. So I have it through doctors, and if I take the example of Dr. Anak, she's working at the psychiatry department of Brugmann, and she collected a lot of reactions of the patients. And one I have in mind is a woman. She had never been to a museum, so she called her friend the day before. Like two people can, mostly women have a phone call before a special moment, and she was like, what am I going to wear? What are we going to do? How do we have to behave? And it was so nice to see that they wanted to do it well. They, and she was more in contact with a friend, and just everything, all these little things it brings with the project, and yes, mainly the fact that many people, it was the first time they enter a museum, and these are adults, and just the world we're living in. So it's very important, of course, to have a lot of devices, what to do with the people when they are in the museum. But the first step is to get them into the museum. And we still have a lot of people, even if we live in a rich country with lots of museums, we still have a lot of people in Belgium who never go to a museum. And talking from the public part, these are institutions for everybody, and I think it's really the role of museums to be open to everybody, to act like safe space, to be like, at the core of that question of citizenship and public institutions. So it's really a way of reminding that everybody has a role in that, and what is very key to that project is that it's cheap, it's very easy to understand, and it's meaningful. So so the dream would be, of course, that it exists at every level, in every institutions, everywhere in the world. Well, we are really pioneers in Europe with that, So I think it's really part of the future, and the Museum of the Future is really a museum where everybody goes and everybody feels welcome.
Yes.
Because I also would like to add that we have two kind of museum prescriptions. One is individually. They can go with one person. They can take one person along, which will also have a free entry to the museum. But we also do guided tours. And I think that's very important, because for some people who are not used to go to the museum, it's very important they can do it within the safety of a group of people they know and they trust. So for us, it's really meaningful to have both options.
Yeah, indeed, when we talk about accessibility, we always stress that it's not a one-size-fits-all. What works for one person doesn't work for the other. But you're saying you offer both autonomous trips for people or social get-togethers, which can help people to break out of like a social isolation, right? That's beautiful.
Amongst other things, I think there are a lot of positive effects a visit to the museum can have, and to participate in culture in general.
Yeah. We mentioned positive feedback from museums, from doctors and patients. Have you gotten any criticisms in that time? And if yes, which were they?
Well, criticism, it's mainly about health workers. They don't have enough time. So, for example, we made a flyer which explains a little bit how it works, with some information about each museum. And one of the criticism we got was, yes, but is it accessible? And then I say, yes, but you type it into Google and then you know if the museum is accessible. They all have that kind of information on the web page. And then they say, yes, but our doctors, they don't have the time to do this. And so I think there's a lot of work to be done in that area. You have, like, grosso modo, two kind of health workers. It's those who have already cultural capital. They know what a museum is about, they know most of the museums, and they can point the patient to the right museum in a dialogue with the patient. But you have also a lot of health workers, they don't have this cultural capital, and they don't know the museums. So it's how do you communicate to this group of both specialists, I could call them, and neophytes, at the same time giving them relevant information. So that's what we're really going to work on the next phase. Is we developed a newsletter, we will talk about expos, etc., and so make it more accessible and more building like a community around the project. I think that's very important. When you zoom out a little bit, it's to find a common vocabulary between the health world and the cultural world, which are both far away somehow.
So right now, in the next phase of the project, you're going to build those bridges, build those communities, and perhaps create more awareness to get the project on a larger scale.
Yes, and it's very difficult to communicate about it because you have to pass through an organization to have a prescription. So each time there's an article in the newspaper, we're happy because we're talking about the project. But we also get lots of questions from patients. Yes, can I ask my doctor for a prescription? Well, no, it's not that easy. Oh, I'm a medical house in Anderlecht. Can I join the project? No, it's only for the city of Brussels. So yes, it's a bit double.
Yeah. So we would hope you want to break these barriers down so you can really have success on a larger scale and not be confined to the Belgian lasagna rules.
Yes, and I think it's beneficial to all parties, not only the museums and the patients, but the social security system. We all know there's a real stressed budgets at the moment, and I think that such a project, there was a study in the UK, and they looked at all the initiatives linking culture and health, and they found out that it represents a save of £8 billion. So that's not nothing.
I was just going to ask you, how do you measure and prove what success looks like? You already gave an indication.
Yeah, I think there's enough studies that prove that. So we're not gonna. That's a bit of difference with the Canadian initiative. It's there. It was one specific museum, doctors, and an academic partner. So they already did that work for us. So I would say we have other specificities than proving that it's beneficial. I'm already convinced it's beneficial.
Yeah, and the number of partners, the way that they ask to continue, we have more and more people asking to be partners. So we can basically conclude that if it was not interesting, they wouldn't ask to continue, because we know how, indeed, as you said, David, that the health sector is just like, they have too much work, they don't have time to talk with the people. So if it wasn't useful, they wouldn't ask for it.
Yeah. The proof is in the huge amounts of positive feedback and the growing success. That's very nice. You briefly touched on it before, is that, well, not every museum is equally equipped to welcome vulnerable patients. What did you ask of participating museums, and what did they have to do to adapt to get with the program?
Yeah, I will take the example of the Alzheimer Association. So they are no partner on the second part, so for 2 years now. And it's very important that, as you said, people coming to the museum, they're just like, people are not showing like, hey, you're sick. So here we have the teams of the museum. They could follow a little workshop just to understand more and to know better about people suffering from Alzheimer. So when the association comes, people from the museum, our staff, they know better about this specific kind of disease. They know how to adapt the way they communicate, how to, which kind of behavior you can have with the patients, what are their difficulties, how to behave with their relatives. So it's really a way of making our museums better, to understand also the needs of the population. And of course, well, this is just one example, but I mean, it's also a way of giving more tools to our staff to know better how to welcome the people without stigmatization.
Yeah. So we're also thinking of giving like small workshop for people with dementia on how to behave with them, and also maybe people on the autism spectrum. But of course, yeah, that's another difficulty. We have very different museums. It goes from Beaux-Arts au Musée Royal des Beaux-Arts, which are really big institutions, to a small museum like Art et Marche. And it's clear that, yeah, you cannot ask the same from all museums. So it's really maatwerk.
It's made to measure.
Yeah. Voilà, we really look at each partner individually and try to support the best we can. I know, for example, the Palais de Koudenberg, they worked with an organization called CAP, and they made like a modular visit. So when they get contacted by a health organization for a guided tour, they ask a couple of questions, and then they modify the visit to suit best for the specific group.
And then you brought these brochures that kind of explain step by step what happens. Perhaps you should explain to the audience what does it look like? So I
Yes,
go to the doctor.
so it's very important that it's also a comic, because one of the feedbacks we got is that there's lots of people in Brussels. They don't speak French or Netherlands or English. So you can almost see what happens. So you talk about it with your doctor or your kine, physiotherapist or whatever. Then he makes a prescription, and together you decide to which museum you will go. Then you go to the museum, you are welcomed by friendly people at the welcome desk. Correct. You can testify of that.
Yeah.
You look at the art, you point your finger at some of them, you talk about it with your companion, and then in an ideal world, the doctor who prescribed it takes some time to have the feedback of the patient. I must say that that's very dependable of the people who describe, because they not always think about it like 3 or 4 months later. Oh yes, you went to the museum, how was it?
Yeah.
Just to add on that, we asked a female artist to do the drawings. All the toolkits, when you're partner of the project, you get all information about the museum. You have a whole list of the partners, health and cultural partners, so you know who you're talking to. And there are specific contacts, so it's very easy. If I'm a health professional, I know I have the list, and if I want to send somebody to Beaux-Arts, for example, I have the contact of a person, a specific person. I just have to call and say, hey, I have a question. So really trying to make it easy, because we know the frustration that exists in our hospitals, like doctors feel like they have only a few time with the patients, or we know that the human factor is very important in the healing process. So it's the way of still doing it, even if it's not in the hospital.
So if I understand correctly, you're growing the project in scale, creating awareness, building bridges, and getting more stakeholders around the table. What would you say to museum directors, museum people from different cities who say, I'm super enthusiastic, I might want to do this too?
Just do it. Just do it. And don't forget that doors are open in Brussels, and that Brussels was the first to do it.
Yeah. There's cities in Austria and France and whatever doing it as well, but Brussels was the European pioneer. Do you sometimes talk to these other European cities about the project?
Yeah, of course. We've been to Maastricht last week. We have been
in a couple of months we're going to Catalonia as well to talk about the project. So there's an increase of interest in the project.
Montpellier last year. Yeah. So it's just the beginning.
Okay. It's a fantastic project. I hope it grows to a national, international scale. Let's start with the federal level. That'll be difficult enough. Thank you both for all the hard work you've been doing. And yes, give a wonderful applause to David and Delphine. Unless we did so few Q&As, I forgot that the concept existed. But if anybody has questions for these lovely people, now is the time. Aha. The gentleman in the back. Wait, I'll throw my microphone. Yeah. Can somebody give this lovely gentleman? Okay.
So,
already are a lot of ways of lowering the thresholds for people to visit museums. There are social tariffs, there's the museum pass, which is fantastic. There's Article 27 and all those kinds of things. Those are ways of trying to attract people to visit museum. What you're doing is more like pushing them to do that. But your doctor, he knows or she knows maybe if these people actually go to the museum, but maybe they don't. So, and this is a measure that's very base level, because there are social tariffs, as I said, in museums, but everybody gets sick at one point. So how does the two questions combined? It sounds harsh, but it's because I'm enthusiastic too. So this person comes into my museum, doesn't have to pay, whether normally it would pay full tariff.
So regarding the budget, it's very simple because I know how much pressure we have on budget on hospitals. So as deputy mayor and as a politician, good news is that you can make decisions and you can decide about your budget and what you're doing with it. So I decided that I would put money on that. So I decided that the city of Brussels would pay for it. So no cost for the doctors and for the health structures, no cost for the museum on the budget, because sometimes they are, autonomous, like with a real structure apart. I mean, they have their budget, they have their structure. So as legal actors, so everything is paid by the city of Brussels, by the budget. And of course, it's for free for the patients. So that was very important for the success of this project. So first question. For the second question, it's really not a project where you have buses of people rushing to a museum. It's like, even if it's only a few people, I'm only happy with it. And in the beginning, of course, sometimes some people, and it's still happening now, some people don't go to the museum, but still they tried. And they've been there, and they didn't dare to enter it, but it's still of the healing process because they tried, and maybe next time they will do it. And it's a way of still, and they talk about it. So when the doctor prescribes, the next time they meet, they talk about it. So maybe, okay, I didn't dare. Okay, why? And so it's a starting point to go further and to go deeper in the healing process. So we also we can have a feedback on the number of prescriptions we distribute, and the number of prescriptions we get at the entrance of the museum. So it's also a way of monitoring it. But yeah, as I said, it's cheap because it's just entrance to a museum. Of course, you have mediation, a few workshops, but it's very cheap when you sometimes see the price of some projects. And yes, I think it's already part of the success. If the people try, maybe they didn't get into the museum, but maybe next time, it's okay. I'm okay with it.
Yeah, I'd just like to add that we're certainly not pushing people to the museum. I think the key element there is the dialogue between the doctor and his patients, because of course it's not at any time in a therapy that you can send somebody to a museum. So I think to make it sustainable also, we paid the full price for the prescription, the patient that used the prescription, and we ask of the museum that that could be accompanied by one person, and that person we don't pay for it. So it's a bit a collaboration with the museums on that level. But I think it's very important that the museums also, because a museum, you have the same cost if there's 10 people or 20 people inside the museum. It's not an extra cost. So for the guided tours, it's a bit different. And to be completely transparent about it, for the moment, out of the 10 prescriptions that we give to a health organization, 1 is being used. And we already consider that quite a success. So in the coming years, we'll enlarge with several stakeholders, but we're also going to try to raise this 1 out of 10 to, for example, 2 or 3 out of 10.
Thank you very much. Does that answer your question, sir? Yes, thank you. Yep. And also, let's not forget about the pushing. Of many of the things that are good for us and heal us are not always the things we go to ourselves, but we sometimes need a little push in the back. So I hope you can raise this from 1 to 10 to a higher amount, and that with a small cost for the city, a huge benefit is created for the populace. So once again, thank you very much. And thank you, the audience, for sitting through this fantastic day. Perhaps one final round of applause.